Okay, it's Matthew Holt. Now I am in one of the larger booths here, which is the Philips booth. The Dutch have invaded, and I'm here with Dale Wiggins. Dale is the CTO of Philips Healthcare, so it's Patient Care and Informatics. So Dale, we have a lot going on in this booth, so give us a quick intro as to what you're showing here and some ideas about where this is all headed and what these devices around us are.
Sure, but at Philips, we really believe that the key to healthcare is allowing clinicians to make informed decisions. So what our booth is set up to do is to show various clinical scenarios in terms of how we're bringing interoperability, mobility, clinical intelligence, and telehealth to light to really enable some of these decisions to be made. So if you look here, we show some of our home monitoring products.
All right.
Because, in a lot of cases, the clinical event happens at home. So what we do is when we walk our visitors through our booth, we take them through a scenario where a patient has a cardiac condition at home. And in a lot of cases, we pick that up with some of the solutions that we provide today in the home.
So can you show us a bit about what we've got here? We have a weight scale and some monitors. Just you start. Take it.
Yeah. So when a patient has congestive heart failure, one of the things that you want to keep track of is their weight. So we provide a very nice looking weight scale together with some various measurements, a blood pressure measurement device, pulse oximetry device, and an ECG device that can capture all this information and then communicate that via communication hub back to a remote center that can monitor these conditions and alert them and help coach them and educate them, or alert someone else when they need additional care.
All right. Are these ones working? Should we take me a quick go? Can you stand on the scale?
I don't think these are hooked up.
That one's not hooked. All right, not hooked up there.
So pretend.
Yeah, well, pretend. I have the Weaving scale in my house, but I don't have all this other fancy stuff.
Yeah.
I hope not to. Right.
Yeah.
So let's.
And the key is to pull all this information together.
Right.
And that's what we do through our remote monitoring service on the other end of it.
Right. And so talk to me a bit about that. Is that something that Philips provides as an independent service, which can then be sold on to plans, providers, whomever, and how is that part working?
Yeah, it's actually something that it's been under various names, but we've been doing this for over 10 years now. Typically works in conjunction with the hospital system. What we're looking at doing is working with hospitals and hospital systems, tying that into some of our other telehealth services to really manage that care transition from the hospital to the home. If you're following some of the legislation, there's going to be reduced payments for patients that have to be readmitted to a hospital within a 30-day period. So we believe by tying solutions such as this together with our telehealth services that you can see in other parts of the hospital, we can help the hospitals better manage those patient transitions and ultimately keep them out of the hospital.
So should we look at some of those telehealth stuff?
Yeah, it'd be great.
Okay, we're going to wander on here. We'll mow some people down in our way. You have like a whole huge group here.
Yeah, so maybe
let's flip around. Let's give people some of the live experience of what actually navigating through HIMSS is like. It's probably a bit like navigating through the healthcare system. All right. So what have we got here?
So this is actually our EICU.
Right.
It's part of our VisiQ solution, where what we're showing here is a typical setup where we're monitoring from one central location multiple ICUs that are spread across multiple hospitals. So the key with the EICU solution is that it provides the tools and the communication to allow one or a small number of intensivists to care for multiple patients. We have smart alerts that identify which patients need to be paid attention to right now. These are the ones that maybe are in trouble, And this is the concept, if you will, that we're spreading across multiple care areas. So this picture here, I don't know if that'll show up in your video, really talks about how you can take the same concepts around utilizing scarce clinician resources, providing the communication mechanisms, the smart algorithms to identify the patients in trouble, and leverage those scarce resources to help to keep those patients on track.
So let's talk a bit about the EACU or the PhysiQ system that you guys acquired, 18 months ago, but maybe not 2 years,
two and a half
years
ago.
ago.
Yeah.
So the way that works is, as I said, it's basically a remote system. I think you're testing it. You actually have a fake patient over there. There you go. That's the patient but that actually would be a patient in a hospital some miles away, typically, right, from a control center, maybe down in the hospital.
Yeah.
Is your sense that that's obviously aimed at the most intensely sick patients? We talked about people earlier. We're talking about people who are at home, who have chronic conditions but are fairly stable. Is your sense that this type of activity is going to spread into different levels of acuity within the hospital?
Well, and in fact, we already have clinical sites up and running today. We have a concept that we call e-hospital in Banner Health in Arizona, where we're already showing great results of providing that same level of surveillance for patients in the general floor. You know, capturing some of those subtle trends and bringing the right, interventions at an appropriate time to ultimately keep them out of the ICU. So, we're doing that at other hospitals with stroke care. Our view is that with the right tools and with the right care models, it can spread to virtually every area of the hospital.
And of course, that's part of the issue here is we have nursing care in the hospital. We also have a lack of full-time physician care. You do have seen the evolution of the hospitalist, but of course many hospitals don't have that, and there's obviously some certain physician shortages in certain areas,
Exactly.
And there's maldistribution of physician resources at the least. That's interesting.
Yeah.
Excellent. So that's actually we kind of almost done two ends of the scale. Do you want to show me some of the other parts of the
Sure.
the booth?
Sure.
We continue on?
Let's go maybe to our imaging
Sure.
area of the hospital. That's something totally different.
Right, and that's of course something that Philips has been a multitude of investments in the early part of the decade.
Right.
Has got heavily into the various parts of the imaging and monitoring business.
Right.
So what are we looking at here?
So what we're showing here is our EyeSight PACS solution. And one of the great things about EyeSight is that from day one, we really focused on how can you enable clinicians for fast image retrieval and viewing wherever they are in the hospital. And it's deployed as, I like to say, it's technically it's a private cloud. The customers pay for it by, as they use the system, we guarantee uptime, and clinicians can see an image within 3 seconds of clicking the button wherever they are in the hospital.
So this is the solution that grew out of the acquisition, the name I can't remember of which, from South San Francisco, a while back. And give me a sense about how it's evolved a little bit since the acquisition and how it's grown both as a product and also in terms of usage.
Yeah. Well, one of the things that we're focusing on now is how to enable what we call federated viewing of hospital or of images, if you will. So if you have a federation of hospitals or hospital systems, how can you see an image from a patient that maybe was seen at one hospital at the other hospital? So that's a solution that we're demonstrating here at HIMSS this year in terms of how do we provide that solution? How do we eliminate some of the duplicate procedures that have had to occur in the past?
Yeah, and among other things, I know you guys sell the CT machines, MRI machines, but clearly the increasing use of those can't go on forever. We need appropriate increasing use of those, appropriate use of those.
Right.
Not the least of which is Bob Wachter wrote a piece on the healthcare blog recently about how one in every 250 women gets cancer from the CT. So there's some issues around that as well.
Yeah,
there's some discussion back and forth, but you don't want to duplicate unnecessary testing.
Right, and that's one of the key things that we're focusing on. When I talked about earlier about one of the areas of clinical intelligence, tracking the dosage that a patient has received is a key part of our research. And we demonstrated at RSNA last year a solution with our CT systems that I believe we call iDose that enables the tracking of those CT radiation, and also to provide solutions that really reduce the amount of radiation the patient receives.
And as the tools we have over here, if we can leverage this gentleman aside, if this is this the this type of tool is something that would be obviously we're showing here some 3D
Bury that motion already.
and that, but this would be a typical thing that could be put in. Would this be only in a hospital or in a physician's office, or is it even a remote station that the physician might set up at home?
You know, the great thing about eyesight and our solutions is that we really do enable the images to be viewed anywhere.
Right.
You know, this display here happens to be a high-end display that you would typically find in a radiology center, but on other displays we certainly show the capability to view the image anywhere.
Absolutely. So that's imaging. It's pretty interesting the way that you are now wrapping that part, which is in some ways was fairly separate from the rest of the sort of the business into the general workflow.
Yeah, but let me bring you over here, because this kind of talks to how it does kind of merge together.
Right.
Because late last year, what we introduced is our new IntelliView bedside monitors, the MX800. And one of the things that we did with this solution is we enable a second display, or even the same display, to be utilized. In essence, this is a separate computer within the bedside monitor that really seamlessly allows you to view an image, get the same image that you might have seen on your eyesight PACS viewer at the bedside monitor. This depiction here represents an OR suite. So if you're in operating theater, you can bring up those same images without the need for a separate display or a separate system at all.
So she's not doing so well.
Yeah, I think maybe this guy's a little bit gone.
Great. Okay. Are we at the end of our tour, or should we? Is there a couple more places we should go look?
Maybe another area would be in emergency care.
Let's go quickly look at that then. Yep.
Emergency care is another key focal point. Typically, I think what happens is, you have an event at home,
right,
and emergency services are called. And then you show up in the ED. They weren't prepared for you. They don't know what's happening. They didn't see.
If you're in Oregon, they'll leave you outside, sitting in the parking lot and call 911. But
I hope not. But one of the things that we're demonstrating is with our MRX defibrillator monitor, how we can allow the patient that is picked up by EMS, emergency medical services, as they're transported, to communicate that information back to the emergency department, such that when the patient actually gets to the emergency department, they're set up. They've already seen maybe that cardiograph that was done, en route or actually at the patient's site, and so they're completely set up, ready to go as soon as that patient gets there at the emergency department.
Cool. So let's go and take a quick look. And then I see also you have the mobile video there as well.
Good point.
About that.
Now what this does is this is actually
Watch out on film. Now that's scared to move me out of the way, you can see.
You want to put it in perspective.
This is actually part of our EICU solution.
Right.
And what it actually does is it allows any bed to be transformed into an ICU bed.
Oh, I see, right.
So at this point, this goes back to that remote telehealth center that we saw earlier.
Just over there.
Yeah.
Yep.
And that intensivist can now see this patient. They can, all the information from our monitors and other devices are sent to that system. That goes through the same smart alerts, and they can, same video system is provided on this mobile pole, and they can provide the same level of care to this patient in the emergency department as you can for a patient in the full-blown ICU.
Excellent. So really, I was to sum this up, I hope we've given the people watching a bit of a flavour of what it's like to be in HIMSS to go around sort of these conceptual pieces put together. But if I was to sum it up, Dale, I'd say that you're basically taking all the different pieces of digital output from both video and also all the various monitors and all the devices and the imaging that you guys have done for all these years, and sort of wrapping a layer of intelligence over it that distributes it to the appropriate place at the appropriate time. So let me ask you the difficult question. You guys have been developing this technology for a while. You've obviously made several acquisitions over the years to sort of put it all together, and obviously you have to work with other people who have other devices and etc. in their hospitals. How far do you think the typical hospital, or even the leading edge hospitalists, are sort of blending and putting this stuff together, or do you think it's still a little bit difficult for them to bring all of this kind of workflow together, and figure out how to get it done, given all the other stuff they have going on?
Yeah, it's not easy. We all have constant pressures, but I think that we are seeing some very good proof points. I mentioned Banner Health in Arizona, and where we're piloting our e-hospital with the hospitalists. They're seeing great improvements. We're pulling in some of our new monitoring devices so that we can deliver appropriate monitoring, not the full-blown monitors that you see there, but they're wireless, they're wearable, and they're seeing operation improvements, reducing costs, and it does already feed back to the telehealth center. So it's you got to pick the right spots. You focus on what's going to have the biggest bang for your buck, and in other cases it's in the emergency department. So nobody that I know of has pulled it all together yet, but I think we're getting the right proof points in place that demonstrate from one area to the next, and ultimately it's going to be all pulled together.
So let me ask you one other question related to, especially the hospital world, is that typically there's been a sort of biomedical engineering guys, and then over on the other side there's been the CIO guys, the technology folks. They haven't always talked a lot. Philips has usually lived in that biomedical engineering world, but traditionally obviously have connected but IT systems, but you're not in the sort of the CERN or the Epic world in terms of those IT systems. So give me a sense of how, as a company, you're kind of making that transition, and whether are those two sides of the hospital, your customer house, starting to speak together properly yet, or is that still a bit of a struggle?
Can we take one more walk?
Yeah, sure. It's part of the fun of the whole endeavor, as you wander around and Dale has to try and remember where he put what part of the of the move.
What you just talked about is
Right.
information technology, and that trend that you just talked about is something that we feel every day. So what we have done is we have made this a key part of our strategy. We have a CIO forum at least once a year, most of the time twice a year, to review our roadmaps, both from a technology and a solution and product standpoint, to make sure that we're aligned. One of the things that we're talking about and showing at the HIMSS is what we call our IntelliBridge interoperability instruments. And the whole point behind that is that we're reducing the complexity of how you have to integrate all these solutions together with your EMR. We call it our one pipe approach, where we're going to integrate all of our systems, other systems, and really provide that in one pipe to your EMR, both inbound and outbound, to facilitate that.
So I assume would make the average CIO rather happier than having to integrate all those different data from all those different devices, which is coming from all over the place. Does that work with it? If I have a device from some other company, does that still flow through this system? So you've done that integration too?
Yeah, that's something that we've been doing for years. In our bedside monitor, we had a little module that plugs in. It was called ViewLink in the past.
Right.
It's part of our IntelliBridge story now. We still have that monitor, or that module, but we now have a system solution that allows you to integrate at each step in the way and pick the area that makes the most sense for your hospital. So it can be at the bedside monitor, in which case we will transport it through our network, back out HL7 to your EMR. We can hook in from what I would call a multiplexer standpoint, where you can pull in all that device data, and then again go through our system and be HL7 out to the EMR. So it's really, sky's the limit as to what you can do.
Great. So I think we'll end the tour there. It's been one of our longest videos I've done at HIMSS, but also one of the more interesting ones, because it gives you a flavour of some of the variety on the floor, some of the things that are coming together in healthcare and both in the hospital world and outside the hospital world, where IT and sort of monitoring devices are coming together. We're going to see a lot more of this, of course, in future years. And hopefully, Dale, folks like you will be helping with the many challenges that are coming together, bringing all this stuff together, because we have a lot of work to do. So I want to say, Dale, thanks a lot for the tour. I've been talking with Dale Wiggins. He's been giving us a tour of the Philips booth at HIMSS. Dale is the CTO of Philips Healthcare. Dale, thanks for your time.